Oconee Fall Line Technical College. Think differently about college and apply today.
Welcome, everybody. I'm glad to have with me again Dr. Patrick Hanson.
Good to be here.
We had a good show last month, and I've had so many good comments on it. And I was in your office the other day, and I mentioned to you off camera, I'm glad to see y'all are actually playing TV 35 in the lobby. So
we are.
We appreciate that. And I walked in the other day, and you or I were on television. So we wanted to update our show. We had a very informative show last time, but we're here in the operating room at Fairview Park Hospital, where you spend quite a bit of time, don't you?
I do. This is home.
So how does this feel in here to you?
This is comfortable. This is comfortable. Not too cold.
Yeah, it's not too cold, but I apologize for having to look at me the way, but the charge nurse that when I come in makes us dress a certain way back here, and I'm glad of that because we are in where you operate on people, and it's kind of fun to come in here when I'm not laying on that table, doctor, because the last 3 or 4 times I've actually been on the table, so it's kind of a little bit of different here, but the holidays are upon us.
They are.
And, you know, we've got Thanksgiving and Christmas, everything happening right here together. So with those emergency things that happen during the holidays, what do we do?
Well, we're lucky because we have the Fairview Park ER that's open 24/7. And so really, if anything happens, you can come into the ER and get checked out.
Okay, some common things. I just want to run down a list with you and I want to get your comment on them. But the first thing is ankle fractures.
Sure.
I know you get a lot of those. Talk about that.
Sure. This time of year especially, everybody's slipping and falling. So the ankle fracture just needs to be checked out in the ER or in the office, really. It's not a problem to check it out in the office, too. The main thing is to come in and get x-rays and see what we're dealing with. If you've got a big swollen ankle that hurts to walk on, then come on over and we can check you out.
Rotator cuff.
Rotator cuff, there's different types of rotator cuff injuries, and really the main thing is to get, once again, into the office and let us look at you. If you fell and your shoulder's hurting, it's a little bit different than your shoulder hurting for years and years or months. So, and that's something that we need to figure out. So come on in.
What about ACL injuries? Do you see a lot of those?
We do see a lot of ACL injuries, and that's usually related to sports, but it doesn't have to be. We see a lot also associated with car accidents or violent twisting falls. So we can take care of those too. And usually people know when they have an ACL tear, their knee blows up, gets big and swollen, and they come in pretty quickly after that.
Something common that you probably see a lot about. Tell me the difference. I know you have carpal tunnel and tarsal tunnel. Is that right?
Sure.
Okay.
Well, carpal tunnel's in your wrist and tarsal tunnel's in your foot, and it's a similar etiology. It's basically your nerve is getting squeezed by something, and so we need to go in there and we need to fix it.
Okay. What about ankle injuries? You know,
Sure.
you sprain an ankle. You know, you might can walk on a few days. It's better, but if that pain consists for how long before you need to come in?
Well, there's different types of ankle sprains as well, and so really it's best that we come in and x-ray you so that we can kind of tell which one you have. To be honest, we like to get people going after ankle sprains pretty soon after. Usually in a week or two, I like you to start walking on it again. But that being said, there's bad ankle sprains where we have to put you in a cast or a boot and take it a little slower.
Something may not be an injury, but I hear so many people, and I've had trouble in the past myself, but plantar fasciitis.
Sure. That's super common in my practice. About every day somebody comes in with plantar fasciitis, and really it's a chronic injury of the bottom of the foot, and that fascia on the bottom just gets torn over time, little tiny tears, and you just stretch it and tear it every time you get out of bed. Usually that's when people complain, is that first step in the morning. So there's a number of different things we can do, you know, bracing and stretching and physical therapy. And so really that's just recognizing the problem and taking care of it.
I know it's the holidays, but do I have to go to my regular doctor to get a referral to come to see you?
No, absolutely not. Just come on in the office and we can set something up, or give us a call.
Okay.
It's easy.
Do you see the common denominator here? All these questions I've asked comes right back we got to get in the office.
Just come on in.
Because the longer it persists, the worse it's going to get, and you may not need surgery today, but if you keep walking on that ankle
That's right.
or whatever, you may need surgery later.
That's right, James. And I think that's a common thread that I'm seeing is, you know, the people here are very tough and they don't want to come see the doctor because I think there's a little bit of anxiety about, you know, do I need surgery? Am I going to have surgery? But a lot of the times we can take care of things, you know, without surgery, an easy fix, and get you back going. Just you got to come in and see us for us to do that.
And you know, people like us, when I mean hard-headed men, you know, we
right.
want to put it off. You know,
That's
mostly
right.
women, I know, going to the doctor and get it handled. But, you know, when it comes to our gender,
That's right.
I don't know what it is. I was talking to a doctor the other day, and he said, James, I'm a doctor, and I don't want to go to the doctor.
That's right.
So it's just something about our gender.
No, I'm not. I'm the exact same way. I don't want to go to the doctor either. So I understand.
What is the right time to have surgery? Is that a bad question?
Well, you know, it's just a tough question because it depends on your problem. There's acute problems that we need to take care of as soon as we can because it makes things harder if we wait. And then there's problems that we can wait and it doesn't really matter much when we take care of them. So really it depends on the problem, to be honest with you, James.
Okay, we're here in the operating room at Fairview Park Hospital. We want to thank Fairview for allowing us back here talking to Dr. Patrick Hanson. We're going to take a commercial break and we'll be back right after this.
At Optim Healthcare, we know you're not yourself when even one part of yourself is hurt. Because in orthopedics, everything is connected. Bones, joints, ligaments, and cartilage. At Optim Healthcare, we're connected too. An orthopedic specialist like Dr. Patrick Hanson in Dublin covers every bone in your body. Dr. Hanson will work together with you to get you back to being you. Optim Healthcare at the corner of Moore Station Road and Industrial Boulevard. Optim Healthcare, Dublin.
Welcome back, everybody. Continuing my conversation with Dr. Patrick Hanson. If you're just joining us, we're here in the operating room at Fairview Park Hospital. I asked you a moment ago what was the right time to have surgery, but let's talk about recovery. I know that's one of the biggest reasons why people put off surgery is they don't want some long, drawn-out recovery.
Sure, and that's usually the tough part for patients. The surgery, you know, that's my job, and then the patient's job starts at the end
After you wake
with
up.
recovery. Right, that's right. And you know, that's physical therapy, and honestly, it's hard work. But you know, I think most people are happy in the end with the end result if they did a lot of good in physical therapy, and the recoveries end up being okay.
Okay, we wake up from surgery. Y'all roll us out of this room
That's
to
right.
recovery, and that's where that process starts. So what should we expect on that road to recovery?
Well, so you'll be greeted by a lot of smiling faces and nice people, especially here at Fairview. To be honest with you, most people don't remember it because of the nice drugs that the friendly anesthesiologist is giving you. So,
Thank goodness for that.
I have to say that most of my patients don't really remember the beginning of the recovery.
You hear that long, faint voice from way out there, don't you?
That's right, that's right. Yeah, most people, even some don't even remember the ride home. So I'd say the
Well, that's a
beginning is
good
easy.
thing, though,
That's
isn't it?
right, that's right.
When will we be able to resume our quality of life, you think?
Everybody's different and every procedure's different, to be honest with you. You know, a lot of the big surgeries we do, you don't start getting back to what we say is your normal until 6 months to a year, which seems like a long time, but really you're doing things that you want to do. It's just we can't say, and you can't say that you're back to where you want to be at that 6 month or 1 year mark.
Yeah. And we are all different.
We are. Everybody heals differently.
Let's talk about your philosophy. You know,
Sure.
we talked about that a little bit on our last interview, and I got a lot of comments about
Sure.
the answer you gave me. So I know I'm repeating that question, but I want you to share that with me.
Sure. I mean, the main philosophy that we have is making people feel better, you know, and there's different feel betters. You know, the sport athlete has an injury and we want you to get back on the field, but the older person who's having trouble getting out of bed, that's a different sort of thing. You just want to be able to walk around, you want to be able to go to the grocery store and do your normal daily living activities. So the main thing for us and the main goal is to make you feel better and to get you moving.
You know, football, we were talking about football
Sure.
a while ago. Football season in high school is ending and basketball season is
Right.
beginning. Are those sports injuries, are they pretty well inevitable, or is there something that we can do to kind of ward off those?
You know, it's yes and no. So there's a lot of preparation and training that goes into all these sports, and training the proper way, which our schools do, you can avoid a lot of injuries. But unfortunately, these strong athletes, the quick motions that they perform, you can't anticipate how they're going to move and need to move, and those produce injuries. I mean, it's inevitable that those injuries happen.
So what advice would you give to budding athletes?
I would say that the multi-sport athlete gives you the best chance of avoiding injury. I think most of the high-level athletes that we have coming through, they really grew up playing, 3-4 different sports. And by doing that, you give muscle groups a rest that you would strain if you only played one sport. I think that's a good thing to start with.
Well, when I was growing up, I never heard the term sports medicine. Tell me when that came along and explain what sports medicine is.
Sure. Sports medicine came along probably a little bit before arthroscopy. And really, I know probably most people have heard of Dr. James Andrews, and he's kind of popularized the subspecialty. But really, athletes are everywhere, and athletics is a part of almost everyone's life. And so our specialty is relatively young as far as orthopedics goes, and so you've got many different branches of orthopedics, and sports medicine is one of those. And fortunately or unfortunately, it affects all our lives.
Yeah, and used to it was just football players, basketball, baseball players. And now I see more cheerleaders injured with the competitive cheerleading going on.
Cheerleading is a real sport. There's no doubt about it. And like you were saying, kind of to come off of you, is that it's not just the football and basketball players, the young athletes, it's the older athletes too that are getting out there. Golfers, tennis players, softball players. Even as you get older, we still want to move around and do the things we enjoy. So you're still an athlete even if you're a little bit older.
Well, I just saw the term recently, but I've always heard tennis elbow, and
Sure.
I've played golf my whole life, and I've always wondered why the way my elbows feel, why there isn't golf elbow. But I just saw recently in a magazine article, there is a such thing.
There is golfer's elbow. It's
you came up with that,
it's
right?
less common. I did not. I can't take credit for that, but there is. It's less common. It's on the other
Right.
side of the elbow, but we see that too.
Yeah, because when you're playing golf, you move in just about every muscle and bone in your body.
Golf is, especially if you're not too great like me, you're stressing
Same
things
here.
that
Yeah, same here.
when you're in the rough a lot, it doesn't help your joints.
Yeah, well, we hit a lot of trees, so
That's right.
That's why we take that
Rocks
axe with
and
us.
trees
Yeah. Well, we have the rock root rule in my group, so we can kick the ball on out in the fairway.
I play that way as well.
Clubs cost too much, don't they?
That's true.
But we're going to take another break, and we'll come back and close things out with Dr. Hanson.
Fairview Fitness Center, open 24/7 with staffed hours available every day. Push your fitness further with our fitness classes. Join today and see the benefits of a healthy life. Fairview Fitness Center, serving our community for over 30 years. For more information, call 353-1900. Visit us at 200 Industrial Boulevard behind Fairview Hospital or log on to fairviewfitness.com.
Welcome back, everybody. I have Dr. Patrick Hanson with me. We're in the operating room here at Fairview Park Hospital, if you're just joining us. But tell me, you're part of Optim Group. What made you join Optim Healthcare?
Well, once I started to get to know all the guys in that group, it really is a tremendously talented group of guys. If you look at all their backgrounds, they come from all over the country, all sorts of training programs. And, when I first joined up, I started operating with a lot of them, and I really realized how incredibly talented they are. And I really feel blessed to have that many good surgeons as my partners and as backup.
And you play golf with them, right?
Yeah, that's right. That's right. You get some pointers there too.
That's right. So you tell me why you chose Optim. Why should our viewers that are watching us right now, why should they choose Optim Healthcare?
Well, I think all they need to do is come into the office and see the total package of care that they get. I mean, you've been into the office.
Yep.
The people in the office are great, our office staff, our nurses, our MAs, and then you meet our physicians and our PAs. I mean, you're getting care that's world-class here in Dublin.
What's behind the, surgery used to, you got pretty well cut wide open. Now you hear a lot about minimally invasive surgery.
Sure.
Where did that come from?
Minimally invasive surgery is the drive to minimize soft tissue injury. And so if you think about it, every time we do a surgery, we're cutting the skin open and then we're going down and somehow getting to where we need to go. And so the point of minimally invasive surgery is to minimize the damage that we do in the surgeries that we perform.
What part of school, listening to that answer, I got to ask you, but what part of school was you in when you said, hey, I want to be a surgeon?
I was probably in high school.
Wow. I wouldn't have thought that early. So what in high school?
Sure. I was blessed to have mentors early on in my life that steered me in that direction, even though, it was just luck, really. I shadowed some phenomenal orthopedic surgeons when I was younger, and that just continued all the way up through college. And, my mentors are tremendous orthopedic surgeons, and I've been blessed in that regard.
So what made you pick general orthopedic surgery?
Well, so there's lots of different specialties and subspecialties in orthopedics, and general for me was important because I like to do a lot of different surgeries, and I think that's important in a community like this because there's a lot of different problems and there's not 15 orthopedic surgeons. And so as a generalist, I get to treat all those problems, and that's what I really enjoy doing.
Let's make that clear to our viewers so everybody's on the same page, but whether I'm having shoulder problems, knee problems,
That's right.
ankle problems, hip.
That's right. Wrist, hand.
That's right, hand, which is a very common thing. But we really want to make that clear. So you don't have to go to one surgeon, and people have multiple problems. So you come to one surgeon, you come see Dr. Hanson,
That's right.
and you can handle all that. What's the best part of your day?
The best part of my day, well, it depends on what day it is.
We're filming this on Tuesday. How about today?
Well, today, the best days are when, you operate in the morning and then in the afternoon you go see patients. And so you get the best of both worlds, really. I love being in the OR and I love operating. That's really the best part in the morning. And then in the afternoon, you see some of the patients that you've treated, some of the familiar faces, and really that's rewarding to see how you've helped them.
I got a few common answers. People commented on the first show we did, but I had several people tell me, they say, Dr. Hanson seems just like a real guy. I said, well, he really is. He just happens to be a doctor. And that's what people, when they think of doctors or surgeons, they don't think of you outside of this blue
Right.
scrubs that you
Right.
have on here or doing something, out of
Right.
the ordinary. So I want you to tell those viewers that are watching now that asked me that question. So y'all didn't tell me to ask this, but I got to ask it. What do you do when you're not being a surgeon?
I do like to play golf a lot, like we talked about. Not well, but I'm a member out at the country club now, and so you'll find me out there from time to time.
So you like to play golf. What else you like to do?
So I like to travel a little bit. Any chance I get, traveling is a good way to get away from me. I trained up in Atlanta, and so every once in a while I'll go up to Atlanta, but I don't stay too long. That's not a place I like to stay too long.
Get out of that city. I'm with you. It is fun to go there, but get out. I asked you the most fun part of your day, but what's the most rewarding part?
Honestly, it's seeing those patients that you've treated in the past, and they come back and they say, I'm feeling great now, and I'll see you when I see you, sort of thing. That's the most rewarding part, that you impacted somebody's life in a positive manner. That's truly rewarding.
Well, I appreciate you joining me today,
Yeah, thank you.
Especially after having you on one other time.
Sure.
It's always good to know you'll come
It's
back.
good to see you.
And I know you're busy, but when I do come in the office, not only do you take time to see me and talk to me, you always take time with those patients, and I know the patients really appreciate that. So, but thank you so much again for joining me, Dr. Hanson.
Appreciate it.
Yes, sir,
It's good to see
absolutely.
you.
I want to thank Fairview Park Hospital for letting us come back in the operating room and film this episode. So, go by Optim Healthcare right here on Industrial Boulevard, right down the street from Fairview Park Hospital. The number's right there on the screen. Call them, and you're absolutely right. When you walk in the front door, Glenda and Karen and all the girls up front are just, they greet you with a smile on their face and take care of you all the way back. So you're absolutely right about that. Thank you so much for joining us today.